Welcome. It's July 11, 2024. I'm Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. Our patient comes to us from Kentucky. She has a herniated disc at C5-C6. She does not want fusion. She was offered other treatments that are far more invasive and less effective. She came to Deuk Spine for this procedure, Deuk laser disc repair. 2, 3, 4, 5, 6. She seems to be moving a bit. I don't know if she's completely, if it's just reflex. Shot? AP? Huh? Ah, propofol. Yeah. Can you use muscle relaxer with that? Shot? More center? Yeah, it's good. Lateral, 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 yeah. Come on. It's hurting my fingers, so you got to hurry up. Shot. 2, 3, 4, 5, 6. Shot. All right, I'm going in. Shot. AP. Wait. Shot. Let's get an AP quick. Yeah, I feel a difference. Quick shot, quick AP, pull to you, shot. All right, towards you, it's towards you. Shot. All right, so we're a little bit too far to that other side. Let me bring it up, come over and shot. Lateral. Interesting. Quick. 2, 3, 4, 5, 6. Shot. 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 AP, quickly. Oh gosh, yeah. I mean, I can tell a difference. All right, perfect. Let's go lateral. Thank God her neck is nice and accessible, otherwise I would have a hard time. I would say definitely no TiVo with a big neck. Her neck is pretty good. All right, so we are in the right disc, the proper disc, shot. We are in the number 5-6. Let's count. Monica, count with the white arrow. 2, 3, 4, 5, 6. Count for us. Everybody agree we're doing 5-6. 4. Shot. All right, and there's our discogram. You can see the dye leaking out. Show us the tear. We can see the tear in the back of the disc. It's pretty obvious. It's right at the, just show us the tear. It's this little black line at the back of the disc there. Go below it. Yes, that's it. You see it there, Henry?
Yes, we do.
So the tear is necessary, the tear in the disc, tear in the wall of the disc, necessary to have a herniation. This patient is suffering with a herniated disc in her neck, and like I said, she did not want ACDF or shots anymore. She wanted to get it fixed, and she became aware of our endoscopic laser surgery at Deuk Spine, the Deuk laser disc repair. It's all done with a 4-millimeter incision. 4 millimeters. That's it right there, folks. We're going to lose just a few drops of blood. I need to see in the front of her neck more. Get rid of the back. Shot. Better. Okay. Next, the dilator goes down over the guide wire. Any questions?
At this moment, no current questions.
All right. As we head down to the spine with the dilator, shot. Let's go ahead and show our audience how these disc herniations with their tears cause so much pain. AP, Coker. And there you have it. The disc herniation causes pain by causing inflammation within the annular tear. That's what this surgery fixes. It's the only surgery in the world that fixes that. Other surgeries, Monica, come on. Other surgeries take your disc out completely to remove the herniation, and you end up with a piece of metal or plastic in your neck, shot, or some bone graft from some dead person called cadaver bone. Or worse, they'll take your hip bone. Long story short, you don't want any of that junk. This is the future of spine surgery. You're watching it today at Deuk Spine.
We have a couple questions.
Can you? We will take some of the questions.
This first question coming from Sharon on Facebook, asking, what is the most common cause of a tear in the disc area?
Hi, Sharon. On Facebook?
Correct.
Sharon, the only cause of the tear in the disc, it is. Thank you. And I wanted to make sure you said that. The only cause of a disc tear, annular tear, is trauma. There is no other cause. All disc herniations, disc prolapses, disc extrusions, bulging disc, ruptured disc, extruded disc, protruded disc, herniated disc, every single one of them. Degenerative disc starts with an annular tear from trauma. That trauma is a car accident, slip and fall, sports injury, something whipping or putting force on your spine and your neck, usually by hitting your head. That is the cause. Once that tear forms, now you have a very, very easy path for the jelly to squeeze out and cause inflammation and pain. So trauma. By the way, here's our 1 drop of blood for the entire surgery. Look at this. The whole surgery is going to be done through this tiny incision, 4 millimeters. We have 10 minutes, Dr. Berndes. We're done. Yeah, the surgery will take about 10 minutes. From here out, and we should be done. Let's take a look. We're going to go to the back of this disc, and there's some pieces of herniation already. We're going to bring our laser in. I'm going to have my staff turn the lighting down 1 click. Thank you. And we're going to get the laser going. Now the laser fiber is, do you guys see the glass fiber there? That
Yes, we do.
is half of a millimeter, 0.5 millimeters wide. So think about that. If you spread your fingers to half a millimeter, you won't be able to see the space between it. But you're able to see this laser fiber at half a millimeter because the scope, the endoscope, allows us to magnify and illuminate what's happening at the bottom of this disc. Luis? So what does the scope provide? Illumination, magnification. What does this tube provide? The tube moves the soft tissues out of the way so that I can have a path to do surgery on the disc. So everything we have here has its purpose. The tube to retract, keep blood out of the field, keep tissues protected. The laser to vaporize and remove the herniation and scar tissue causing her symptoms, to get rid of the herniation. The endoscope is to magnify and illuminate with light so I can see. All right, any other questions? There's herniation, by the way, the blue stuff.
Yes, we have a couple more questions. Next one coming from Lanu on YouTube,
Lanu. Yes, Lanu.
asking accounting question. Do you get any tax break for your facility, which is very expensive to run?
We get no tax break at all. But thanks for asking. Our government taxes the hell out of us. They take as much as they can with their greedy little hands. and they provide virtually nothing in exchange, nothing in return. Nothing. Unfortunately. But we pay our taxes because I don't want to spend my rest of my years in Club Fed. So we have to pay taxes. They take a lot of our money that we could give to patients. That was a herniation right there. Yeah. Oh, let's talk about insurance. Oh my gosh. So I was supposed to have sinus surgery number 6 tomorrow. Okay, we laugh about it. Everyone's saying again. So point number 1, why does it take the surgeon 6 surgeries to get it right? Okay. Yes, I always talk about doing it right the first time, don't I? But even I'm a victim of the incompetence of surgeons.
Two of the most unsuccessful surgeries known to mankind. Number 1, knee arthroplasty. Number 2, sinus.
Yeah. So I'm going on sinus surgery number 6 by the same surgeon. You'd think I'd be smart enough to not go back to them. But I keep hoping that the next time it's going to get better. But the biggest issue is my insurance is United Healthcare. And the doctor is a United Healthcare doctor, surgeon. The facility is a United Healthcare contracted facility. And the surgery is not even the Deuk laser disc repair. It is a sinus surgery that everybody gets. And guess what? My insurance is denying the surgery, saying it's unnecessary, which they denied all of my surgeries, by the way, saying all of them were unnecessary, even though I couldn't breathe and I was about to die from obstruction. So, insurance companies lying. This is United Healthcare. Their profit is $5 billion. That's with a B, every 3 months. Imagine having a business that makes $5 billion profit every 3 months, and then turn around and tell a neurosurgeon who has 70 employees, all on United, that I'm paying their bill, that I can't have my sinus surgery when I'm going to die from not breathing because the surgery is unnecessary. Okay, with an in-network surgeon, an in-network facility, and an in-network procedure. How crazy has insurance gotten, folks? And I have people complaining, oh, the Deuk laser disc repair is not covered by my insurance. Well, I'm sorry, I really am. But at the same time, another herniation. At the same time, it doesn't matter whether the surgery is standard or the doctor's contracted. They still deny, the insurance companies still deny payments for procedures when they shouldn't be denying it. And their only motivation, folks, their only motivation is greed. When is someone going to stand up and stop these greedy insurance companies from denying our treatments that we need to be healthy? When are they going to put people ahead of profits? The problem is there's nobody holding them accountable. All of our politicians are on the take from the insurance companies and the medical record companies like Epic, where they're getting kickbacks for mandating that hospitals buy the Epic system for millions of dollars. The VA system has spent $6 billion on medical record system, and they still doesn't work, and they've been paying for years. Okay? So we have a completely corrupt healthcare system. And the people like you guys are, and me, patients, we're suffering from the greed of corporate America. And it's disgusting. It needs to end. The only way it's going to end, you get your president to do something about it. Congress to do something about it. But I just wanted you all to know that I suffer with you. I have the same issues you do. I can't get my insurance company to pay for a surgery that's necessary, that will help me, I hope, get better. So, my surgery is being canceled for tomorrow. It sucks, but I'm not going to an allergist. I'm not going to take medicine for my sinuses. I want it fixed. By the way, there's a herniation right there coming out that was sitting on top of the spinal cord. So I will tell you, this herniation has gotten worse since I reviewed her MRI. Thanks. If you look at her MRI, it doesn't look that bad. But this thing is huge and it's sitting right on top of her spinal cord. Questions?
Question coming from Brad on YouTube,
Hi, Brad.
asking, in a C1 to C2 fusion requiring translaminar screws, where do they place the bone graft if the screws are somewhat in the way of where the graft is traditionally placed in the harms fusion?
They place the bone graft still posteriorly in between the lamina. There's a space. So the translaminar screws are going to go in the lamina, but there's still a gap between the C1, bottom of the C1 posterior arch and the top of the C2 lamina. That's where they put the graft. Look up Brooks fusion. All right, next question.
Next is a comment and or seeking advice from
Almost done, Dr. B. It's worse than I thought, by the way, because 3 minutes. 3 minutes. Go ahead.
Comment and or seeking advice coming from Tootsie on Facebook.
Oh, Tootsie. I like Tootsie. Tootsie Wood.
Yes. Asking, I'm having such pain in my back. It doesn't seem it wants to ease up. It just feels like it's getting worse.
Yes. What's the advice? Or what are they asking?
That's why it was a comment and or seeking advice. Yes.
Oh. I know, Tootsie, and we want to help you get better. So come to Deuk Spine and let's get it fixed. Let's get it fixed.
Next question coming from Brad once more on YouTube, asking what kind of bone graft do you feel is best? Allograft, autograft, BMP?
All right, Brad. I do not believe BMP should be used. I used to use it a lot, but it makes complications. I believe in using autograft and allograft, both. If I'm doing a fusion, I use autograft and allograft combined. I think using the patient's own bone is very good, and it should be used whenever you can. And I always take the patient's lamina bone and their facet bone, and I grind it up, and I use the diploic bone there. 1 minute left. What is that? Yeah, just about done. I see the spinal cord down there. You can see we've gotten rid of the herniation that was sitting on top of the spinal cord. This is some scar tissue. I'm just looking because I don't want to leave any more herniation. I need 1 minute and we're done. You can see fibers of the PLL, posterior ligament there. A little bone spur, a little scar tissue. But so far, everything's gone really well for her. We're pretty much done. What other videos can we show the audience, Henry, while I go and make my way to the conference room so I can answer the rest of the questions, because we're finished. Let me just look at this corner.
Yes. Yes, we can show how this procedure actually works and what people to expect when getting this procedure.
Wonderful. Okay, welcome back. And I just want to show you, we lost 1 drop of blood, literally 1 drop for the whole surgery. If she had a ACDF or artificial disc, there would have been 25 to 100 cc's of blood, which is a lot. And the incision is 4 millimeters, just 4 millimeters. Okay. See the incision?
Yes, we do.
That's it. We're going to put a bandage on it and we're done. I will take some benzoin if you want. I can dry it up and do it. Thank you. All right. Let's go to a testimonial and then I'll come there and I'll answer questions. So type up your questions. I'm Dr. Deuk with the Deuk Spine Institute. We have a patient who just had surgery yesterday. And if you were tuned in online watching our live surgery broadcast, you saw her get 2 discs fixed in her neck. She's had a prior fusion done with an ACDF and a metal plate, so we fixed the disc above the fusion and below the fusion. She had adjacent segment disease. And how long were you suffering with neck pain and right arm symptoms before you came to Deuk Spine to get it fixed yesterday?
Over 20 years.
Over 20 years.
Over 20 years.
And you had the Deuk laser disc repair done. You can see we had to make 2 incisions on the front of your neck. How do you feel after the surgery you had yesterday?
Awesome. Never felt like I've not felt like this, and I couldn't tell you how many years. I've not been able to actually have a normal life due to the pain. Hurting so bad, having to lie down during pretty much after lunchtime.
Do you still have that pain right now?
No, sir.
It's gone.
Gone, yes.
Yeah, your neck is still a little stiff, and you
Yes.
got to get used to that. But you did have the fusion, fusions always cause neck stiffness, and we can't fix that. But the pain we can fix. So the pain you had before is gone.
Yes, sir.
You happy?
Very, very happy. That's an understatement.
Now you have a funny accent because you come from Bluff City, Tennessee. Isn't that right?
Yes.
All right. And why did you travel to Florida for your surgery?
Done a lot of research, and then I found you. Thank God. Greatest blessing that I've ever had. Best doctor I've ever been to in my life.
Thank you.
I can't really put into words how I feel. It's beyond. It's the greatest blessing ever. It truly is.
Well, I'm glad you're doing well. I know your husband is here. He's been very supportive. He was here throughout the surgery yesterday, and you can actually see in the video footage that we made 2 tiny little 4 millimeter cuts in the front of your neck, went down through the neck, not damaging anything inside, and getting to the herniations where the tears were. And actually, you could see the tears on the discogram that I did. And they were big, and we were able to get in there and clean out all the herniations with the laser, and we didn't have to do fusion anymore. We didn't make your neck any worse than it came here with. And the nice thing about the Deuk laser disc repair is it's a stabilizing procedure, getting rid of pain and neurological compromise. I checked you today. You came to us with weak arms, and now you have normal strength in your arms just 12 hours, 24 hours after your surgery.
Yes. Not had that in so many years. So many years.
All right, well, is there anything else you want to say to your fans out there?
Anybody suffering with chronic pain, you have no idea. It is well worth coming to see. Like I said, he's the best doctor I've ever been to in my life. He actually cares. First doctor I've ever had in my life to hug me and ask me how I'm doing.
And compliment you on your nails.
Exactly. He loves my nails.
I
He
do
loves
love
my
your
nails. Highly recommend him, like I said. Very well worth everything. He truly does care. And the team here is awesome. The nursing staff, everybody was tremendously, I can't express enough how everybody was so good to me and just went out of their way to make sure that I had everything I need. I was comfortable. You know, it was just a very wonderful experience. It truly was.
And I appreciate you sharing. You also had the Deuk plasma rhizotomy, I just remembered, because she had facet joint pain as well as the disc problem. And she was having pain turning her head to the right, weren't you?
Oh yeah, I was having extreme pain. I was turned into when I couldn't hardly turn to my right. It was going down into my right arm extremely bad.
And that's gone.
Yes.
Amen. And it's gone permanently. So I'm very happy for you. When are you heading back home?
Saturday morning.
All right. Well, enjoy Florida for a few more days. You take care of yourself. You've got my phone number if you need anything.
Yes.
All right.
I thank you
take care.
so very much.
You are more than welcome. It's my pleasure to take care of you.
Even with my funny accent.
All right. Let's get you out of here, okay? Go enjoy the beach or something. Good morning, I'm Dr. Deuk. I'm here with one of my patients from Canada who traveled actually from Toronto to Florida to have Deuk laser disc repair to fix 2 herniated discs, one in his neck, one in his lower back. And you had your lower back done last week, and we were actually supposed to do your cervical last week, and we had our air conditioning break, and we got it fixed over the weekend, and you had your neck done yesterday. So you've actually had the Deuk laser disc repair done on your neck and your lower back. How's your lower back feeling?
Brand new.
Amazing,
As if it was never injured. I still am in shock. I can't believe that you were able to achieve this result after I've been suffering with this problem for just over 5 years now.
Yeah, since your accident.
Yeah.
Trauma is the cause of herniated discs. You herniated your disc in your lower back. You had pain for 5 years. In Canada, what did they do to treat your pain in your back and your neck?
I started with medications, nerve meds, narcotic painkillers. I was instructed and told to have nerve block injections to help with pain management. I did physio, I did chiro. Finally, I got to a point where I started to do the nerve ablation therapy, and I did 2 rounds of that.
But the pain came back.
And the pain always came back, and I was looking for a repair, a permanent solution, so I can get back to, having some normality of my life. And I found the Deuk Spine Institute, sent my MRI over right away. I had my consultation within not even 10 days with Dr. Deuk in person, like in Zoom. 3 weeks later, I flew out here and I feel like brand new.
It's amazing,
so thank
isn't it?
you. Yeah,
You're welcome. You're welcome.
This was life-saving for me because I didn't really have a great life before this experience.
And you can tell the pain is gone now.
Yeah, I was having numbing in my legs. There was days where I couldn't even walk. I was completely debilitated, stuck in the house, pain, numb. I thought I was going to be like paralyzed at one point. That's how bad it was.
And how are those symptoms now that you had the procedure?
Gone. I have full feeling back everywhere. Like, it's unbelievable. I can't believe it.
All with the Deuk laser disc repair. You could see we went in and we found the actual tear where the herniation came out in the back of the disc, and we used the laser to clean it out, debride it. Now here you are doing fantastic.
Yeah, thank you.
You're welcome. All right. I'm Dr. Deuk, and I have ended this testimonial because I wanted to get to your questions. We've just completed a very nice surgery on a lady from Kentucky, and she had a herniated disc, thank you, at C5-C6. You're going to see in a future video we're producing, Henry and I, that C5-C6 is the disc between the number 5 and the number 6 bone in your neck. It is the most common disc to rupture. If you look at the spine here, you have the number 1 bone at the top, then there's 2, 3, 4, 5, 6, 7. And we fixed the 5-6 disc, okay? There's other ways to do it with metal in the front, metal in the back. Somebody asked me, where do you put the bone graft when you have translaminar screws? Translaminar screws go into the lamina here of C2. The bone graft goes between C1 and C2, right in here. You wedge it in here, okay? Just like that, where the pin is, okay? Right behind the spinal cord. So, somebody is just testing my knowledge of fusion, and I think it's hilarious. But the questions you ask me are like those of a kindergarten student, that level of knowledge. Remember, when I say I was trained at the top neurosurgery training program in the world, I wasn't joking. I was. And there's not a spine surgery I cannot do. I can do them all. But we do the Deuk laser disc repair because it's the best for the patient. It's the safest, it's the most effective. You saw that 4mm incision. Why don't other surgeons do it? They don't know how to do it. And they're highly motivated financially to do fusions and artificial discs. They're being paid off by companies to do that. And they make a lot more money. That said, we will take our questions. Our patient's surgery went perfect. Couldn't have gone better. We lost 1 drop of blood. I guess it could have gone better if we lost 0 drops of blood. But One drop of blood, folks. I mean, shoot. That's like a vampire with a cavity. Can't even get any blood out. But 4 millimeter incision, tiny, got a good few pieces of herniation out of there. And what I found was that the herniation had punctured through further back than the MRI showed. It went through the posterior longitudinal ligament. I had to open some of the PLL with the laser. You saw me cutting those fibers that ran left and right. Those are the posterior ligament fibers. The disc herniation went past that and was pushing on the spinal cord. When I got the piece out, if you go back and look at it, you see that big piece that came out. You can see the spinal cord, the dura right below it, but the dura is red. It's inflamed because the herniation is so pro-inflammatory it causes inflammation. So, and the dura does have a blood supply, so it's going to have an inflammatory response. It turns red, and that's what we saw. All right, let's take our first question.
First question coming from Nixon on Up on YouTube, asking, my dad is showing symptoms of peripheral neuropathy. He is awaiting an MRI 3 to 6 months out. He lives in Canada. Would you advise that he advocates harder to be diagnosed sooner?
Yeah, so thank you for asking. Great question. We have a Canadian patient who is having trouble getting an MRI. I'm hearing he has neuropathy. I'm not sure. Just so you all understand, this is why the definition of words is so important. Neuropathy, if it truly is neuropathy, is not a condition that you find anything on the MRI. If it's radiculopathy, then it's a pinched nerve. If it's neuropathy, then it's damage to the small nerves in your feet and hands, and there is nothing on the MRI to look at. It's just normal. There may be findings on the MRI, but they would be unrelated to neuropathy. Neuropathy is what diabetics get because the sugar's too high in their bloodstream. It goes into the small nerves and kills the small nerves. They get numbness, tingling, and burning in the bottom of their feet. If that's what your dad has, then the MRI is not going to make the diagnosis and it's not going to help him. But what we need to know is he have neuropathy or does he have radiculopathy, neurogenic claudication, which means do his symptoms change with movement, like standing, sitting, laying down? Does it get worse in certain positions, better in others? Neuropathy, true neuropathy, which is destruction of the small nerves, never gets better, never gets worse, doesn't change with position. It's the same. It doesn't matter if it's morning, nighttime, throughout the day, it's always burning in the bottom of the feet. If that's what he has, he doesn't need an MRI. What he really needs is treatment of neuropathy, which is medication, and sometimes a spinal cord stimulator if it's bad. That said, if his symptoms change, then he doesn't have neuropathy, he has radiculopathy, and that's a pinched nerve, and that's where he needs an MRI. Should he advocate? Yeah, absolutely, but good luck. You know, Canada, I don't think they really care. That's where America's going. Honestly, I think Canadians have it better than Americans because at least the Canadians know their health system sucks and it's rationing care. Americans think they have great health insurance, while the health insurance companies are making billions of dollars in profit like weekly. Americans, while they're denying treatment and care, Americans think they have great insurance when they don't. So, like me, United Healthcare, supposed to have my sinus surgery tomorrow, and United Healthcare is denying it, so it has to be canceled. Next question.
Next question coming from Brad, once more on YouTube, asking, what are your thoughts about using wires for C1 to C2 fusion? The Galley, Brooks, or Jenkins method, they are somewhat considerable archaic by surgeons. My C2 pedicle is too thin for pars or pedicle screws.
Well, first of all, I commend you on your research and knowledge that you have acquired in the pursuit of understanding what's going on with your C1, C2. I guess I'm a bit surprised that it's your neck we're talking about. You took me off guard there. But why are you getting a C1, C2 fusion? I assume you're young, and the only reason you'd need a C1, C2 fusion would be a C2 odontoid fracture, which would be traumatic, or rheumatoid arthritis with a pannus and ligamentous laxity. So it's very unusual for somebody to need a C1, C2 fusion. I do the C1-C2 fusions, but I typically do it because people have arthritis in the C1-C2 joint. It's very rare. I see one case a year. And I'm just wondering what your problem is. Maybe you've got a C2 fracture that's traumatic, like an odontoid fracture. If that's the case, and you're considering a C1-C2 fusion, then I would use the either a C2 lateral mass screw or a C2 pedicle screw. It's the same thing. You're saying yours pedicle is too narrow. I don't believe that. I believe you. I believe that you believe your pedicle is too narrow. I don't believe your pedicle is too narrow, but maybe it is. I just think your surgeon is a chicken shit and doesn't know what they're doing. I would love to see your CAT scan and be able to measure your pedicle myself. That said, it does have risk putting in a C2 pedicle screw. It could end up injuring the vertebral artery. What do I think about a Brooks-Galley fusion? Well, basically that type of fusion is an older fusion of C1-C2, and it has a lower chance of fusing. What other options do you have? You have a C2 screw through the front where the surgeon could try to capture your tip of your odontoid and pull it down or lag it down. It's called the C2 lag screw. I've done those before. They're not as successful as going and fusing C1-C2 in terms of treating a C2 fracture. So for me to advise you, I would need to know far more about your problem, and I would need to do an MRI review, which I'm not doing right now. Okay? But you're welcome to sign up for one.
Next question coming from Sharon, once more on Facebook, asking, I had an L3 to L4 fused last year in November, and I have so much more pain now than I had before. More pain in my buttocks area. Now, my surgeon suggests a nerve stimulator, and I have read and heard a lot of stories.
Sharon, avoid the nerve stimulator. Avoid the nerves. You don't need it. We can fix your pain at Deuk Spine. Like literally in 30 minutes, we'll have you fixed. So, Sharon had a L3-4, L4-5 fusion. She's now got pain in her buttock area. Your pain is coming from one or more of these things. Number one, piriformis syndrome. Look it up. Piriformis syndrome. We can fix it for you here. Literally 10 minutes. Number two, sacroiliac joint dysfunction. Sacroiliac joint pain, basically. We can fix it for you in 10 minutes. Number three, L5-S1 adjacent segment disease, either discogenic pain or facetogenic pain. We can fix it in 30 minutes. So whatever it is, your fusion may not be the problem directly. It may be adjacent segment disease or piriformis syndrome. Either way, we fix these things all the time. Do not get a stimulator. Bad idea. Come to Deuk Spine and let us fix it.
Next question coming from Lanu, once more on YouTube, asking, is there such thing as herniated disc research center that is similar to NIH?
Is there such a thing as a herniated disc research center similar to NIH? No. NIH stands for National Institute of Health, not that I'm aware of. Deuk Spine Institute is the closest, most advanced disc research center in the world. Why? Because we're the ones looking at the disc as the source of pain. Everyone else is ignoring the disc. Only a few people understand the disc can cause pain. The other doctors don't think it can, and they just ignore the disc. Yeah, we are the disc research center of the world, basically.
Next question from Tracy on Facebook.
Tracy, hi.
Asking, is it possible for a MRN, I don't know if they meant MRI, to pick up compressions of peripheral nerves?
So is it possible for an MRI to, I guess MRN is maybe magnetic resonance neuroimaging or nerve imaging. Is it possible to pick up compressions of peripheral nerves? The answer is yes, it is. If you get an MRI of your knee, for example, you could probably find out if something is pinching the nerve near the knee. So yeah, that's done, for sure. You need a musculoskeletal neuroradiologist. Musculoskeletal neuroradiologist. They're the best at finding those things.
And then lastly, our question from Brad, once more on YouTube, asking, in a posterior cervical exposure, is there a layer of fat directly midline between the muscles, or is that also fascia? I've seen that in some of your old videos, and I'm wondering what it was.
Well, Brad, thank you for asking. Here's the midline in the cervical right here. Is there a layer of fat between the muscle and the spine, I assume is what you're talking about? Yes, there is some fat right here where the muscle attaches. Remember, muscle needs energy to work, and muscle loves fat. That's why there's so much fat around our muscles, because muscles can actually use ketone bodies, which are the breakdown product of fat, as fat's being metabolized for energy, for it's hard to explain, but when muscles, like fast twitch muscle fibers versus slow twitch muscle fibers, fast twitch is like white meat, slow twitch is like red meat. Slow twitch has more myoglobin and more hemoglobin and more circulation. And the slow twitch muscle fibers, like the ones for posture in your neck, they burn more fat. The fast twitch muscle fibers burn more glucose and glycogen, which is a sugar. So the red muscles burn more fat, the white muscles burn more sugar, and that's one of the reasons why they have different colors, like chicken breast versus chicken thighs, okay? But your postural muscles are definitely slow twitch fibers, and they consume more fat, ketone bodies, and so there's more fat there, yeah.
And that is it for questions.
All right, hope you enjoyed surgery. We got a next patient, we got two more. The next patient is from
Next patient is from Nevada.
Nevada, Las Vegas, Nevada. He has flown to Florida to have us operate on his back. He's having back pain. He has 3 herniated discs, L3-4, L4-5, L5-S1, and he's got pinched nerves on the right side. He's having back and right leg pain and weakness. He also has piriformis syndrome, which is what I think one of the other viewers might have after their L3-4, L4-5 fusion. We're going to do a piriformis muscle release. So you're going to watch the DLDR, 3 discs, and then we're going to stop the broadcast. We're going to start it for a piriformis release. It'll take 10 minutes to do. And then the last surgery today is again, a Deuk laser disc repair for disc problems, 3 of them, and a rhizotomy for something.
Yeah, lumbar.
A lumbar facet rhizotomy. So that patient has disc pain and facet pain. Thanks for joining us. It's been a pleasure. I enjoy your questions. They are awesome.